What is going on YouTube? In today's episode of Inked Respiratory, we're going to be going over something that we have in our arsenal, the incentive spirometer. It's not our bread and butter because that's albuterol. This is just a really good tool that we have at our disposal. Incentive spirometer comes in two pieces, usually this cage here and a mouthpiece here. You just connect it only one way. After that, there's a million different variations, but they all do the same thing. They all have a bunch of numbers here. That's usually based off milliliters, and it's usually a goal that they set based on your age, weight, and gender. So you could be a 22-year-old male, and they would set your goal like at 1750. But what I want you guys to focus on is actually this guy right here. You'll see a smiley face, and you have an arrow on the bottom and an arrow on the top. Essentially, what it's indicating is they want you to stay in that happy medium. What that does is, when you take a deep breath in, you're taking a nice gradual breath in. It wants you to take a very gradual breath, and I'll show you guys here in a minute, to a nice steady breath, because that's how you inflate the lungs the best. So that's what I want you guys to focus on more. Not so much the number of how big of a volume you can get in, but actually more of a nice steady gradual breath. So trying to keep that, essentially in this case, in the happy smiley face for an extended period of time, 15 seconds, 20 seconds, make that your goal. So if you can do it 15 seconds, then try doing 20, 30, 35, in increments of 5 is typically the best way to do it. But that's what is most important with this, because if you think about it, let's think of a water balloon, very small, hard to inflate. If you take a deep breath in and then really, really hard, you'll fill up the balloon, and then the air will escape, and then you are left with a deflated balloon. Now take a deep breath in, make a nice tight and press in, nice slow gradual pressing in or exhaling into the balloon, and it's going to start to expand. The lungs respond the same way, obviously. So a perfect example is a glove. It's definitely not a water balloon like I talked about earlier, but as you can see, I'm going to take a full breath of air and I'm going to blow as hard as I can, all my air out of my lungs, and you'll see how much inflation happens. Not bad. Hard inflation. Now we're going to do a nice gradual breath. And I have a lot more air in my lungs still to go. I just didn't want this thing to pop. So as you can see, just very simple and easy. Taking a deep breath really, really fast and pushing all your air out of your lungs does inflate the balloon a little bit, but nice, slow, steady exhalation, which in turn means nice, slow, steady inhalation in this purpose for the IS. Nice, slow, steady exhalation. Inflate the glove significantly bigger and easier than it would be doing a very, very sharp, fast exhalation. Yes, these are exhalations, but in IS it's inhalation. You're breathing in the IS. The same concept still applies. Obviously, they're not that hard to inflate. They have a good compliance, is what we call it. But taking a nice gradual inhalation will inflate the lungs in all their fields, all lobes, and have good aeration throughout all lung fields. So what it's going to look like is like this. You're going to exhale with your mouth on it or not, it doesn't matter. You can go So that's kind of what you want to do. You want to kind of, as best as you possibly can, keep it in the happy medium. That's going to tell that your body or your lungs are inflating at the proper rate. You're going to have great aeration, and you're going to inflate all your lung fields. This is, and it's at the spirometer again. It's a great tool that we have. Typically, we give these in hospital to patients who are bedridden that typically aren't as active, or typically anybody who goes in the hospital should have these, because now that you're in the hospital, you're obviously not walking around, you're not doing daily activities, you're not doing very much of anything. A lot of the hospital is sitting and waiting. So your body is lazy. It's going to want to take shallow breaths, breathe a little bit faster to compensate, and just lay there. So what you want to do is you want to have these guys at your disposal so that you can take those big breaths for an hour or one every commercial, whatever the case is. Obviously, don't do too many, because then you'll hyperventilate, meaning you'll breathe too fast and you'll get a little lightheaded, dizziness. Doesn't feel good. So keeping it to for an hour, doing one every 15 minutes, one during a commercial, that will usually equate to a little bit more than for an hour. But that is a good amount of time to do this, because when you're in the hospital, like I said, you're not moving around a lot. So it's good to actually encourage deep breathing, because you don't want to get those lungs to start to collapse, so you don't want to get atelectasis. Atelectasis is a little part of your lungs known as the alveoli start to collapse, and so what you want to do is always keep those lungs nice and inflated. When you're doing normal activities, they always do, because if you're walking, picking up things, doing daily activities of life, you're always going to be taking deep breaths. If you're in the hospital sitting down all day, you really don't need to do very much breathing if you're just doing this and chilling all day. So these are helpful tools to encourage deep breathing, valuable assets to our respiratory arsenal or disposal. And I highly encourage you guys, show this video to people who, grandparents who have a hard time seeing it, and they do better by seeing by example, or just need a little more explanation. Use this video as a tool, as a resource to those people who kind of don't understand what the value of this actually really has. This can be used at home too. If you're obviously not as active due to your conditions or whatever the case may be, this is still a good tool to have at home. So like, again, we're going to go ahead and show you. We'll try to keep it in the smiley face. And that, I feel a nice, good breath of air, good volume, good expansion of my lungs. Thank you guys for watching. If you guys have any questions, leave them in the comments. I do read them all. I do reply them all. As always, have a rad day. This is Respiratory. We're out.